name is Pamela Story. I'm a speech language pathologist. I've been an ASHA certified speech language pathologist for the last 15 years. I first met Dr. Pedro when I was working with a 4-year-old student, 4-year-old child, who had pervasive developmental delay as his diagnosis. He was delayed in language, specifically syntax, morphology, and social pragmatic skills. So I had been working with him for about 6 months, and the speech therapy, it was play-based speech therapy, but it was, slow and steady progress, but definitely slow. And then his mom told me that she was going to bring him to come see Dr. Pedro for cortical integrated therapy. It was the first time I had heard about it, so I was intrigued. And then Will came back to me the next week for speech therapy, and I noticed a significant difference within 1 week. His ability to focus had improved. His emotional regulation had improved. It was almost as if he was a different child. This intrigued me quite a bit because it really helped him to move right along in the progression of speech therapy. So he continued to see Dr. Pedro for cortical integrated therapy and to see me as well. And he really just moved right along in his speech and language development. He then went on to school, to kindergarten and first grade. And then I happened to go from private practice to working in the public schools that happened to be the same public school that he was going to. So then I was able to see how all of the work with Dr. Pedro presented itself in terms of the classroom. I was working with him in the school setting as well, and even though, after I think a year or so, he stopped seeing Dr. Pedro, but the residual effects continued. He continued to improve throughout the course of his, schooling. Using the cortical integrated therapy as like the neurological foundation, improving that neurological foundation allowed him to respond to speech therapy in a much more deeper, richer, quicker, and more profound way. It became like a global progress. Even though I was targeting specific things, he also was able to progress globally. It was just a wonderful thing to see. So after the first couple of visits, when I realized what amazing results had occurred, I went to go listen to one of Dr. Pedro's presentations, and was very interested in seeing a lot of the other results that he had, not only just based on speech and language development, but also the motor disorders that he had worked with, as well as patients with stroke or traumatic brain injury. To me, as a speech pathologist, it was just really fascinating, and it's just like a very efficient way of helping people to regain communication ability because of stroke or TBI or developmental disabilities. I came and observed in his office, and I watched him as he evaluated people using eye movement in order to evaluate what was going on neurologically. As he likes to say, eye movement is a window into the brain. So with eye movement, he finds out what part of the brain isn't working optimally, and then he can target that area of the brain to improve function, which then in turn improves speech production, whether it be disfluency, whether it be language development, whether it be organization. And it's just amazing to see the results. So that was the first time really that I had seen anyone use eye movement to evaluate problems. And so working together with the information that he was able to ascertain from his evaluations and working with me, the efficacy of treatment improved 100%, because we were both focusing, he was able to give me information to help me focus more clearly on particular therapies. It's been great working with him. He's a wonderful person. He has a lot of information, and he's very willing to share it with other professionals. He has a great mind.